and I have children who are robustly healthy. They're allergic to nothing. They get A's in school. They don't need special help. All the stuff that their mother had to have. So, you know, I don't have to wait to have a laboratory test to tell me that I think I did the best, made a good decision for my kids' brains and for their lives. And I think that at the end of the day, every parent needs to have the right to make those decisions. Every parent, with consultation with compassionate healthcare providers, gets to make these decisions. It ought not to be something that is mandated by the government and supported and aided and abetted by mega-million-dollar corporations. And it's chilling to me that that's something that I have had to have really heated conversations with progressive/radical people. It's terrifying to me that progressive/radical people think that this is okay for any reason. Another reason that I wanted to speak also is clearly I'm an African American person, and my population of parents that I serve as a birth worker are mostly, at this point, people of color and people who are poor. And I gotta say, I mean, I'm really grateful for the outrage that's come up around this bill, and I'm really grateful to see people of privilege out there, you know, protesting against it, showing up in Sacramento in a powerful way. You know, they've never seen so many people come to speak out against the bill, and that's all beautiful. And I'm not being sarcastic about that at all. But Black and brown and poor people have been having their kids taken away from them by CPS for refusing to immunize for quite some time. It's not new for them at all. It is one of those things that has been used as a label to label somebody a bad parent, their choice to not immunize. I, within this past year, had to advocate for one of my clients who, her son received one round of vaccines and she immediately noticed a change in him because she is an aware and very loving young mama and watched her little infant's personality change. He was more upset. He cried more often. He cried that screeching cry that parents who understand about vaccine injury know that screaming cry that some children get after they get immunizations is a sign of bad things coming if they continue to get their vaccinations. She didn't know all that. She just knew that she had a perfectly loving, amiable little baby boy. He turned into a screaming, unhappy person, and she didn't want to continue to immunize him. She went to WIC to get some help and information, and the WIC nurse reported her to CPS.
Wow.
Every day. Happens every day. Happens every day. Happens every day. Okay. So yeah. So luckily, this young man, this young mom, had supported folks around her, myself, and I rallied other birth workers and folks. And this mom is also somebody who was also aging out of the foster care system. She herself was already in the system that was really poised to take her baby away. After one conversation with the public health nurse that was sent to her home, was followed up by CPS coming to her home, and it was followed up by CPS coming back with cops with guns drawn, removing her son from the house. So I really want us to get to the point where we talk about this bill and what it says and what it means, because I want people to you know, this is already happening in our community. And because we live in these little pockets where we don't see each other's pain very well, this bill gives carte blanche for this to happen to more people. When the government gets to decide what decisions that parents make, what medical decisions that parents make on their children's behalf, then this opens the Pandora's box for more people to have their lives intruded upon by, you know, the semi-military here. We need to also be really mindful that there are adult vaccines in the pipeline as we speak too. That hideous Gardasil vaccine that's wreaking havoc on teenage girls in this country right now. And then there's a whole, you know, slew of adult vaccines that are in the pipeline that are going to be mandated. People cannot say, I don't want it. The way it's set up now, vaccine manufacturers have no impetus to give us a safer, better product. All of those things are in vaccines because they're cheap. The mandate of a corporation is to make as much money as possible. So they're going to use the cheapest ingredients possible to get their product out. When you have a product, it's a dream, it's like the massive wet dream of any corporation to have a product that's mandated. Everyone must have it, and I have no impetus to make it better or safer because I have no liability. This is the dream of the corporate person. I pray that we stop this.